6'7", 6'7"? Not really, especially when it comes to who the best clinicians are. They're not the ones that rely on evidence-based practice, and they're not the ones that have a lot of experience, and here is why. Evidence-based practice and tons of experience usually equates to the least effective clinicians. Remember, evidence-based practice is highly manipulated, and you can get it to say whatever you want it to say. If you want to say that stretching is great, evidence-based practice will tell you that. If you want to say that stretching is detrimental and increases the risk of injury, you can find evidence-based practice that will tell you that. If you want to find evidence-based practice that tells you that everybody needs to be dry needled, you can find that. If you want to find evidence-based practice that says that dry needling is 100% completely bogus, and trigger points don't even exist, you can find that. So rather than relying on evidence-based practice, what you should be doing is relying on science. You know, the stuff that you learned in high school and undergrad and then reviewed in PT school and then never learned how to apply. That's the problem you're having. If you don't know how to apply physiology, anatomy, biomechanics, neuromuscular physiology, you will be completely lost, and you will have to fall back on evidence-based practice, which will push you to diagnosis, which doesn't matter, which will make you follow protocols, which won't work, and you will become more frustrated and confused as your career goes on. So stay away from evidence-based practice. I don't need to do a study to tell me what neuromuscular physiology is and what it does and how I can use it to my advantage. And now the second point, people that say, well, the more experience you have, the better clinician you are. Most clinicians that have a lot of experience base what they do on evidence-based practice or experience of working with mentors who were evidence-based practice-based clinicians. So the more experience you have doing things incorrectly, the worse you get. So the more you do diagnosis, the more you do protocols, the more you do special tests, the more you do SFMA, the more you do symptom modification gimmicks and get certifications in dry needling and cupping and strength and conditioning and this and that and this and that, all you're doing is going further down the road of the broken medical model and further away from science. So if you understand first how to think critically, then understand how to apply science in a clinical setting, then you have the opportunity of being a phenomenal clinician. And guess what? You'll be doing the opposite of everybody else who's in your clinic or everybody else in town. And they'll be saying, well, why aren't you following evidence-based practice? And you can say, because it doesn't work. I know how to think critically. I know how to apply science to the patient that's standing right in front of me. That gets me to root cause, which means I get results in one visit rather than 2 times a week for 6 to 8 weeks to feel like we're making progress and getting over the hump. Now, here's the cool thing. Even though they didn't teach you that in school, and even though you're not going to learn that in some weekend continuing education course, I can teach you that because in the shift, the first thing we do, the first module we do is critical thinking. So we teach you how to apply or how to take apart your thinking first so you understand what you're doing and why you are doing it. Then we will go through a full review of neuromuscular physiology and really focus on the parts that they skimmed over in PT school. Remember the law of reciprocal inhibition that they covered in like 5 minutes? We're gonna spend quite a while on that. Remember the difference between GTO and muscle spindle? We're gonna break that down and tell you why GTO really isn't in the big picture. So after we teach you how to think, or give you the skills to think and take apart your thinking, then we teach you the basics of neuromuscular physiology, and then from there on, we will teach you how to apply those. How to functionally screen somebody to see what their function looks like in less than a minute, how to put them on a table and test each individual muscle for neuromuscular facilitation, because that's going to get to you to the root cause. And then when they do test positive for inhibition, how you can quickly and easily, in less than 10 seconds, reverse the inhibition. So as you go through and you treat their entire body in one visit, in less than a half an hour, get them off the table, redo a functional assessment because symptoms don't matter. Now you can assess function and they can do what they couldn't do a half an hour before that. And that gives you direct line to what you're going to give them for their home exercise program, specific to their needs. So stop thinking that you need to research. The more research you read, the more lost you're going to get. Stop thinking that you're going to find a mentor that has all this experience and all these certifications that's going to teach you all this wonderful stuff. No, they're not. They're going to teach you what they did in 1970 and 1980 because that's all those people know, because they came out of the broken education system just like you did. Stop asking people who are just as lost and confused as you, with just more letters after their name, for advice. Find somebody that can change everything you do to get you out of the broken medical model so you can be the clinician that you've always wanted to be. When you're ready to do that, hit me up.